Hello, welcome back to my YouTube channel. Feels weird saying that. Today, I want to talk about my pre-op journey. My hair is so big. It's full of secrets. Oh my god. Bitch. Oh, I gotta go to bed. Hi, welcome. Thanks for clicking on my face. In this video, I kind of want to talk about my pre-op journey and the fucking struggles that I had to face and the obstacles we overcame. So, for starters, June of 2018 is when I started the pre-op, like the pre-op evaluations and clearances and testing and whatnot. So I have a binder here I showed you in the first video, and this is all of it. I'm gonna go in order of when I went. It might be a little bit, might be a little shaky, but that's me. Are you surprised? Okay. So I actually went on May 30th for my first meeting with my pulmonologist. From then we scheduled a chest x-ray, which was just like standard, and then we scheduled a sleep study. Now I begged and pleaded. The glare is really terrible. I'm gonna leave my glasses on this video because it's better for me. Let me know in the comments down below if I should just not wear glasses during videos, because the glare is really distracting for me as I look at myself. But like, just let me know if you care. If you don't, then I won't either. I will, but I digress. Okay. So I begged and pleaded for an at-home sleep study. It's where they give you the little machine at home, and like you follow the steps or whatever, and that report, it's generated back to them, and then you make an appointment for like the follow-up, and he talks about it and whatever. If you fail it, you need to have one done at the lab, and if you pass it, it's fine. So of course I failed it. It was a night that I was having really bad ovarian pain. I have polycystic ovarian syndrome, and when I'm not regulated on birth control, my ovaries freak the fuck out. So I remember that night, I wasn't feeling good. I put the machinery on, and then I went to bed. I woke up a few hours later. I think you need to have like 5 or 6 hours of like actual sleep. And I woke up and I was in pain. I was like, fuck this. I ripped it off. And I didn't realize I only got like 2 hours in. So I pretty much took the L, spoke to the doctor's office, and I was like, okay, can we just schedule one? Because no. So we scheduled one. It was terrible. Hated it. And of course it came back that I have severe sleep apnea. I don't know if I still have it. My mom says I don't snore anymore, so I was given a CPAP machine, and that's that. I brought the CPAP machine with me when I had my surgery, because if I didn't, they said they would turn you away if you don't like bring the machine with you. So I was like, I'm not risking that. Did I sleep with it? Sometimes. Did I hate it? Yep. And I personally never felt a difference. I never really woke up feeling any more refreshed or less tired, or I don't know. I just didn't like it. So that was that. I received my clearance because I was following the guidelines, and I was using it often enough for them to be like, okay, she's good. After that, it says on June 5th, I went for my initial gastric consult, I guess, with my gastroenterologist. We scheduled an endoscopy, and that was on June 14th. Had the endoscopy, waited a week or so, and then the results came back that I had severe eosinophilic esophagitis, which briefly, eosinophils are a type of white blood cell. They line your esophagus, and with EOE, which is what the condition is abbreviated to, eosinophils build up in your esophagus, and it becomes like asthma of the esophagus. Eventually it can lead to strictures and GERD and acid reflux and stuff. I have a notification. Okay. So he put me on pantoprazole, which I'm still taking. Whatever. Little pills. It's weird. This diagnosis really like took me by surprise because I was not expecting it. I never had heartburn, never had any sign that something could be wrong. So that took me by surprise. Let's see, that was June 14th. I had my initial meeting with my surgeon on June 6th. I'm not going chronologically anymore because I already got off track. So I met with my surgeon. In the surgeon's office, it is the surgeon, nurse practitioner, and the dietitian. The dietitian, I had 6 consecutive months of weigh-ins with her. And I've only met with the surgeon a handful of times, informally mostly, because the majority of the office visits and phone calls and prescriptions, and that's all handled by the nurse practitioner. She pretty much like runs the show. So it was my first formal meeting with my surgeon. And she basically just like evaluates you mentally and sees like if you're aware of what you're doing, if you've decided on a procedure, why you decided on that procedure. She pretty much asks you, are you doing this for yourself or other people, or a whole bunch of that. I had my first out of 6 months, I keep saying 6 months of consecutive weigh-ins. I had my first, I think my first was early May, because I remember I was like, okay, so my 6th will be in November. Hopefully we can have surgery by, I would have loved to have the surgery right after Thanksgiving, like second week of December, so I can just like go all out on Thanksgiving, and that's what I really wanted. But of course things don't go the way you plan. So my second meeting was on June 7th. I had blood work done on June 11th. So blood work, let's see, I think I have the labs with me. I do. What is this from? November. This is not what I need from. Hold on. So I got the blood work done, and the results went to the surgeon's office, and my nurse practitioner reviewed them, called me and said, Justina, I just want to let you know everything looks good except for your white blood cell count. It's pretty elevated and we want to refer you to hematology. The first thing you think of is, oh my God, I have cancer. It's absolutely terrifying to be referred to a hematologist / oncologist. It's terrifying to go to the office and make appointments with them and see the other patients. It's just truly a nightmare. So it says that my white blood cell count was a 14.9 when it should be anywhere from a 3.8 to a 10.8. That's like the reference range that they give. So mine was 14.9. I was also really deficient in vitamin D and B12. I was put on a prescription vitamin D supplement. I took it once a week for 3 months, I think. But back to the blood issue. So I made my first appointment with the hematologist. This was before I knew that I had the eosinophilic esophagitis, so keep that in mind. She sent me for labs. They came back, and the first thing she did was give me a script for blood work, and it said leukemia/lymphoma on it. And that is just, I can't imagine anything scarier than potentially being diagnosed with something like that. It was really scary. I had those labs drawn, and I had to wait like 2 weeks to get the results back. And by the grace of God, I was negative for both of them. But my blood counts were still weird. The white blood cell counts were still a little off. And so I went for another set of labs, and this time she tested for a bunch of different viruses, Lyme's disease, HIV, a bunch of different things. And I remember the period that I was waiting to get those results back, I got the diagnosis of the EOE. So I was pretty excited because I was like, oh my God, that's gonna make perfect sense. My hematologist is gonna be so excited. So I went to her to get those results, and she said I was negative for everything. And actually that lab, my counts were normal. And so I explained to her I was recently diagnosed with this, and she was like, that makes a lot of sense, that you were probably having a flare-up. And so that's most likely the cause of the weird counts. She's like, I'll see you in a month. We'll do more labs to just make sure everything's good. So those labs, and then the labs after that, thank God, I'm so grateful. But they've been normal ever since. So, but it was a very stressful month. And I was just starting a new job, like literally the same week. It was just, I don't know how I did it. It seems dramatic in hindsight, but I was bawling my eyes out all the time. Like I was so scared. So that's that. Where was I? Okay. So I spoke about pulmonology, gastro, blood. Psychiatric clearance was one of the last clearances that I got. It was fine. I pretty much wrote it myself. Like she was like typing and I was like telling her what to say. So it's whatever. My abdominal sonogram came back fine, negative for anything. My liver was slightly fatty, but nothing to cause concern. Cardiac clearance, everything was fine. I think I covered most of it. And I also had neurology clearance. So everything else that I mentioned is like mandatory, but depending on your prior history, they might add like another specialty clearance. So for some people it might be gynecology, for some people it might be rheumatology. For me it was neurology. If you want to know why, I will make a video explaining the malformation that I was born with, because yeah, I'm just full of surprises. I really hope I made sense. If ever you have any questions, you can DM me on Instagram, you can message me here, you can comment here. I'm fun, I'm easy to talk to. I will answer any question you have. I am an open book. Thank you for watching. I hope I shed some light on what could potentially be a similar scenario to yours. You hear insurance requires 6 months and you're like, oh my God, in 6 months I could have surgery. No, it took me, I started in April 2018. I had surgery February of 2019. So it took 10 months when it should have taken 6. And I am a firm believer that everything happens for a reason and that things happen when they're supposed to and yada, yada, yada. When it's all said and done, bottom line, I'm so grateful. I'm happy with my choices, my decisions. And yes, now I want to help some of you make decisions. I don't know about that. I don't know. Yes, I filmed these the same day. I might film another after this. Ooh, in my hair. My hair's too long now. Not for long, I'm gonna be cutting it soon. Because she's falling out. Bitch. Bye.